Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
So this is Drama. Drama is about a 4-year-old greyhound that unfortunately got out of the owner's yard and got hit by a car. Somebody saw the dog got hit, called Maddox. Maddox picked the dog up, which is, you know, it's a city Department of Domestic Control officers picked the dog up, brought her over here. And then the dog luckily had a chip on the back, and that's the reason why you have chips in your dogs, because if they ever get loose, we were able to scan them, see the chip, find the owner immediately, and the owner came right down and then claimed the dog. And then from there, we went through the process of trying to figure out what exactly was going on with her. So this is Drama. This is just a radiograph of the chest cavity. So her head is up here. This is the spine. This is her front leg. And then this is the chest cavity, the trachea or the breathing tube. And this is the heart. And then normally the heart lays right on the sternum, which this is your sternum right here. The bone that the ribs come off here. See, each rib is coming off here, and spine up here, and normally the heart sits right on the sternum, but it's raised up because there's air and there's some fluid in there. If you see these lines on here, it shows that there's fluid in there. That was blood. So any type of blunt trauma, if you're smacked by a car, which this dog was, you're going to rupture the lung tissue. And then there's all vessels in there too, blood vessels, and those were probably disturbed and they bled into the chest cavity. So we tried to put a needle in and remove this air about 3 times, and then after that we said, you know, this is enough. Sticking a needle in 3 times is enough. We have to get a chest tube into this dog. So what we did was we took a chest tube, see how large this size is, pretty good size, and put a cut through the skin, and then put a hemostat in through the cut in the skin, and went into the chest cavity, put the tube in, placed it so that it's aiming down towards the front of the chest cavity. And if you see, there's all little holes all the way through here on both sides in the tube itself, so that when Ethan was pulling on the syringe, he was trying to pull air out and fluid out of here. We got lots of fluid for the first couple days, and then that went away to show us that the dog bled initially into the chest cavity, but then that dissipated, so there wasn't any further bleeding. Now we're just getting air, which means there's a rupture of the lung tissue itself. We're hoping by using that continuous suctioning, that placed a negative pressure within the chest cavity itself and put a seal. We're hoping that that puts a seal on that hole in the lung and then closes it off. Right now, we just turned off the Pleurovac this morning, and we're going to suction through the day today. We're hoping that this is going to stop. So we'll show you what we have to do. Ethan and Angie are going to come here and... Come on, Drama. She also has a fracture, a really horrible fracture on the right elbow that unfortunately is in 4 or 5 pieces. And it's way at the distal end of the elbow, as you can see here. It's right in here, right in the back of the elbow. It's in several pieces. So she doesn't put any weight on it, but she's able to support weight on 3 legs. So we sent the radiographs to a surgeon, and the surgeon said, I'm not going to be able to fix that. So we're going to have to amputate the leg if she survives this part, the chest trauma part. She's a lucky dog that she's here, actually. So what we do is Ethan's going to come in and as sterile as possible, we're going to try to open this up, the tube right here that's going into her chest cavity, this tube. And it starts here, goes right through 2 ribs and enters inside the chest, and it's about this long. So it starts here and it goes all the way down inside her chest cavity, and it's got all little holes in it so that any air that collects in the chest cavity we're going to pull out from this outer port here. So this is where she was had continuous suctioning going up until this morning. So we're on our 3rd try now of trying to make sure. So now Ethan's going to clamp down on the tube and close it off, and then take a hemostat, and it's just a double protection mechanism that we don't want any air going into the chest tube because that would be a disaster. So, and then he'll place a syringe, he'll open it up, place a syringe on the tube, open up the clamp. Give me that.
Stay. It's okay.
And then try to pull on the syringe, and we have no air going into it.
It's okay.
So that's good.
Stay.
Now before he pulls the syringe off, he's going to, it's okay, clamp it, double clamp it again to prevent any, so that's the first clamp, and then a hemostat over the tube.
It's okay.
To prevent any air going in from the outside, and then put the closed port on again over the tube. There we go. Take that off and keep it closed. Good. So far there's no air in there. We're hoping we can go 24 hours with no air. If we can, then we'll think about removing that chest tube.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world on our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. PAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. PAWS. We're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel. Personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mugwanago, which boasts a fully matted 5,200 square foot training hall. While in Mugwanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
So this is Pen. Pen is about a 1-year-old cat that is a female spay kitty that, I mean, these owners totally love this cat. It actually belongs to the little girl that plays with this cat and hangs out with the cat. They were gone for a little vacation, and they left the cat home alone with food. And when they got back, they said the cat wasn't looking right, and they found multiple piles of vomit all over the floor, mostly green in color. And some of it had little pieces of plastic in it. They're very careful because they know that this cat likes to eat everything. So they can't think of anything, but they have a small child at home. So anything is possible. She's a really nice cat, but she's not feeling well, as you see. So this is her x-ray. This is her laying on her side, and then laying on her back here. Here's the spine, the back legs. This is the chest cavity with the heart, and this is the abdomen. And all these intestinal loops, they have like some bright white opaque material in here, and then kind of a comma-shaped pattern in the intestines. Here's all the intestines. Very suspicious for some kind of foreign body, and that's what we're thinking. And she's very painful and uncomfortable, and when we did an ultrasound, I'm fairly certain that I can find the piece of material in there. So we're going to take one more x-ray at 9 o'clock tonight and then make a decision if we're going to go in or not.
I know, it's okay. mounted up some plastic earlier yesterday, and the blood work that we took was pretty indicative of gastric outflow obstruction, which is a forearm body. And then we have retaken x-rays, which are pretty suspicious of a gastric forearm body as well. So, hasn't vomited anymore since she's been here, which is good, and she's been rehydrated, which is pretty darn important before going to surgery. So we're into the abdominal cavity. Now we're looking for anything abnormal in the small intestine and the stomach to see what she ate. This is her spleen. That looks normal. Don't feel anything in particularly abnormal in her small intestine, so now we move on to the stomach to see if we feel anything that she could have possibly eaten and gotten stuck in her stomach, getting stuck on the way out into the small intestine. Always better to check and make sure that there isn't anything in there than to miss something because you didn't check. So we don't want any stomach contents getting into the abdominal cavity, so we take lap pads and put them all around the stomach to catch anything that would potentially come out. We put sutures in either side of the stomach where we're going to cut in between, just another kind of catch-all to hold the stomach out of the body cavity to make sure that none of that intestinal contents gets into the body cavity. So I do not feel anything in the stomach, so we're going to sew that up. We'll run the intestines one more time just to make sure, because I like to double check a second and third time just to make sure. There's always the possibility that in getting rehydrated and just starting to feel better and move things through the small intestine, that maybe if she did have a foreign body in there, it has moved into the colon, which we don't cut the colon open. because there's way too much bacteria in there to do that. Or here, there are surgeons that do surgery on the colon, but not to remove a foreign body. If it makes it to the colon, it should make it out of the body. So we didn't find anything abnormal, but there's a lot of really, really hard feces in the colon. So is it a possibility that she did ingest something and it caused a problem and that's why she was vomiting? And then with rehydration, with IV fluids, pain medication, anti-nausea medication, was that foreign body able to be moved through her stomach, through her small intestine, and is now in her colon? We just don't know. We'll have to wait until she has a normal bowel movement. We can kind of take a look at that and see if we see any foreign objects in there. That can take a day or two, and it depends if she starts eating normally, not vomiting when she's eating. Kind of go from there. I am going to take a biopsy of different sections of her small intestine just to make sure that there isn't something else going on, that we would want to send those sections out for histopathology to make sure that she doesn't have like irritable bowel syndrome or something like that that's causing her to vomit. Flushing out the abdomen to try if any intestinal contents did leak in there. We wanted to make sure that we get it cleaned out. There really shouldn't be a reason that any should have gotten in there, but we're always better safe than sorry. Oh, good job. Good job waking up so fast.
Hey, welcome back.
So by her x-rays and her blood work, it made us very, very suspicious that she had ingested something and had a GI foreign body. After going in surgically, we did not find anything in either her stomach or her small intestine, which is kind of disappointing to not be able to take something out and be able to make her feel better right away, but it's also encouraging that possibly that foreign body that we saw in the x-rays in the first place, and according to blood work yesterday, has moved through and is now in her colon, and hopefully she will be able to have a normal bowel movement, and whatever that was in there will come out with that. So she has done well through surgery. She is recovering nicely, and hopefully everything will go well from here.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
Hi, this is Mega and Dr. Dale Crescent for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
There's been a lot of excitement at Haws this year, from newsworthy animal rescues to helping everyday people adopt a new family member. We at Haws know we couldn't do it without the help of people like you. Help us continue our success in fulfilling our animals' needs by donating to the Haws Two-Step Project. By making a general donation and pledging to donate toward our much-needed future expansion, you help us continue the Haws mission of helping animals in need. Log on to hawspets.org and donate today.
Humane Animal Welfare Society.
I think we're all excited to be here today. I'm Dr. Marlo Lichtenberger, the owner of Milwaukee Emergency Center for Animal and the one that took care of Beatrice for a year and a half. And then we have Karen with Beatrice, the owner of Beatrice. And then we have Nicole here, who's going to accept the reward for turning the man in that did this horrible thing to Beatrice. So just to give you a little story, about a year and a half ago, Beatrice came into our hospital and she was in shock. She was brought in by the domestic control officers. She was 90% of her body was burned and she was in horrible shape. We never thought she was going to survive, and we brought her through multiple surgeries over about a 6-month period, and then finally was able to work with a doctor at Fredert Hospital who was kind enough to come here and help us place pigskin on Beatrice, which helped the healing of the skin finally. And then finally, over about an 8 to 9 month period, we were able to get Beatrice all healed up and back to normal. And then the next thing was that Animal Fairy Charities was kind enough to put out a reward for $2,000 for the person that could find the guy that did this horrible thing to this cute little doggy, Beatrice. And Nicole stepped forward, and I want to present the $2,000 reward from Animal Fairy Charities for turning in this horrible man, and he is now in jail. And we thank you so much for this. Thank you, I really appreciate it.
Today's show was brought to you by Haws, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.